Technology is changing healthcare in multiple ways. We connect the doctor and the patient. You will have literally at some point in time healthcare at your fingertips that can be viewed through your smartphone. Hi, my name is Fred Peer. I'm the President and CEO of Poulos Incorporated. We're a software company here in Chicago that focuses on chronic disease management and bringing solutions to doctors so that they can treat certain health populations. Today, we're going to talk about healthcare made easy, discuss the complexities that exist within the provider practices, and to talk about ways that where technology companies are making things easier. My guest today is Mike Poulos, who is the President and CEO of Trellis Incorporated, and I'd like Mike, introduce yourself.
Thanks, Fred. Thanks for having me on the show. As Fred was saying, Michael Poulos, I'm the CEO of Trellis Health Partners. We're celebrating our 20th year here in Chicago. We have offices in Kansas City, Miami, Philadelphia. We've been managing physicians, hospitals, and healthcare data since our inception. And thanks for having me on the show.
Great to have you, Mike. What I'm excited about is we see so much complexity in the marketplace with technology and how doctors are having such difficulty adapting to that. Share with us how you are making it easy for the provider, for the doctor, to use technology in such a complex environment.
Well, in healthcare, there is so much technology out there that is offered to these physicians. They're bombarded with so many different systems, and the problem with it is they are locked to what they're on, their platform they're on, or the system that they've gone with. So their data, their financial data, their clinical data is all in these systems, and they find out that really they can't access that data. So what Trellis is, in the complexity of healthcare, what Trellis does is we can come in and we have an interoperability with our technology where that doesn't stop us. So where most of the vendors out there, you have to use their platform, their software, we can come in and work as long as we can access data and provide the doctor with the analytics that he needs to be able to run his practice. And that's usually very difficult for them to find.
We see obviously the billing part of any practice is extremely important. So your finances really have to be shored up, and you got to make sure that you're bringing in the revenue. Otherwise, your practice is going to suffer.
Oh, absolutely. Yeah, putting that process together is a very important piece, and the physician to be focusing on to be focusing on patient care and making sure that he knows the processes in place between his staff and the Trellis team, that they don't have to worry about it. And if something goes wrong or if there's an issue, that the process is in place to fix the issue, that everybody knows the problem going on. In healthcare, there's hundreds of patients walking in and out of the office every day. And so there's multiple insurance companies. And so how do you know you got everything right?
Right.
And that's very difficult to be treating patients and then watch the other side of the business.
So touch on the billing piece of this. Talk to us about, I'm sure that there's going to be people in the audience who are wondering, well, it's a very complex subject. How do you make it easy? I hear it all the time. I hear doctors who want to keep the billing in-house. I hear doctors who want to go ahead and outsource it, offshore, inshore. What have you seen? Being in the business for 20 years, what do you see? What is the answer to making it simple and to improve the bottom line of providers' practices?
Right, and that's keeping the eye on the ball and making sure that the work's done up front correctly. And if you are just going through a day and you don't have any process or procedures in place to make sure that information is all complete, to make sure your reimbursement is there, your billing issues are all handled and managed, because the next day you have another 100 patients. And the next day you have another 100 patients.
Right.
And so the Trellis system and our process and procedure make sure we're tracking that and making sure that all that information is done correctly. When it's not, we're holding the staff accountable and making sure that those processes are all maintained and managed.
So that's the key, it's the process.
Yes, absolutely. And it's not like mistakes are going to happen in the financial end. There's over 37 pieces of information that has to be given to an insurance company before they're going to pay the doctor.
37 pieces
At
of
least
information.
that much information.
And so what we're doing is really focusing on how to make that simple.
Right.
And if a doctor has a number of staff that are responsible in putting that information in the system, it sounds to me like it's really just open for problems.
Right, because there's another patient coming right after that. So when you look at least finding somewhere between perfection and making sure that you have the information right, but it's identifying the problems. When you can identify the problems, you can fix the problems. If you sweep them under the carpet, then it becomes this ongoing calamity of finance that the doctor then starts getting underwater, and then the problems start.
So it sounds to me that your secret sauce is the process.
And the data.
And the data.
Accessing the data, analytics, analyzing the data, and not making it some sort of mystery that the doctor, because most people are charging large amounts of money or not even able to offer that type of service.
So when you talk about analytics, I mean, we hear in healthcare big data, we hear about analytics, we hear about drilling down on the data. How does Trellis make that easy so that the provider understands the benefit of that?
Right.
And then how does Trellis make that easy for access for the provider so that they can benefit from the analytics of the data?
It's getting the right information in front of the doctor at the right time so the doctor can make decisions on how to manage his practice. And all that data, all the financial data and clinical data, that's what Trellis has expertly been able to manage all over the country for groups of 100 physicians to groups of 4 physicians that need that data and they need access to the data. So we can convert clinical and financial information and give the doctor exactly what they need, because it can be inundating to a doctor. It can be very scary.
So let me see if I understand, because one of the pieces of a discussion that I want to raise for our audience is the area of interoperability. But I want
Right.
you to go back to the analytics. What is it that, are there certain tools that you folks have, that you and your team has, that you can come in and really differentiate yourself from everybody else in the marketplace? Talk to us a little bit about that.
Our ability to convert data, our ability to access clinical and financial data on a multiple of systems that are in the marketplace right now, and to be able to take that data and make meaningful information out of it, meaningful reports, meaningful analytics for a practice. They're dealing with so many insurance companies now. The number of insurance companies and insurance products with the Accountable Care Act is growing exponentially. The physicians don't know what they're supposed to be getting reimbursed. So to take all those thousands and thousands of pieces of information and go, this is what your business is made of. These are the issues that are at hand. And that's what Trellis does. We put that information in the physician's hand. Here's what the insurance companies are reimbursing you for. It's a business model, and the doctors, unfortunately, are the low end of the payment. The hospitals are getting taken care of, the insurance companies, the pharmaceutical companies, and at the end of the day, these doctors are trying to they're at the end responsible for all the patient care, but they can't because they don't have access to that data to really run a financially viable practice.
Now, in the past, I've heard you talk about the 4 or 5 areas of high cost and salary for the doctor.
Right.
Salary, rent, billing,
Yes.
malpractice.
Right.
That area of billing is a very high cost for the doctor. What are some of the things that you're looking to change, and what are some of the things that you're doing to make it easy,
Right.
but also to drive more revenue to the bottom line?
Right. Well, doctors, since the onset of EMRs and the popularity of an EMR, the physicians unfortunately have been, they required now to do even more work. And they're actually, with an EMR, spending more and more time charting and basically managing that patient from a billing standpoint. The EMR, the physician's now responsible for putting that information in the system, which the billing and the financial all feeds off of. So physicians seeing their time evaporate, that they now are spending 10 to 15% more time in front of a computer screen than in front of a patient. And so now the doctors are taking on that billing responsibility, because if they don't manage the clinical report right, the billing will be wrong. And they're investing more and more of their time, so they're spending more time away from patient care and more time in dealing with the computer system with the EMRs. So for Trellis, we look at that as the physician needs to be reimbursed for that properly. So less of the responsibilities on the billing side of it is the billing staff, and more of it has become the physician. So the compensation needs to change, and the physician needs to learn how to utilize the systems they're currently on or migrate to a new system, but utilizing that current system and becoming profitable.
Well, because I'm privy to some of the things that are going on, I know that
Right.
this is to be continued. You have some pretty exciting things that will literally revolutionize the billing area for doctors. And
Right.
before we close, I want to touch on one other point. We hear a lot about interoperability. We know the frustrations with technology. Ever since 9/11, we've been hearing about how critical interoperability is, not only from safety, but from practices being able to talk to other systems,
Right.
hospitals talking to other systems. Share with us what your thoughts are and how you see Trellis and technology making that easier for the doctors as they're faced with these challenges.
Yeah, that's the data has basically put handcuffs on the physicians and on these practices, and the systems, there's so many of them out there. Trellis has built extraction tools to actually go into the databases, the raw data, and extract the data out, every piece of data, 100%, and then be able to map that to our analytic tools or to map that to another system. And unfortunately, in the past, only large systems, hospital systems could afford that. And so over 20 years, we've perfected those tools to be able to walk into almost any practice that we can access that data and give them that information, extract the data, use it with another practice management system, or take an EMR that doesn't have a good a financial tool, and and migrate the data over to the
Are you
practice
doing any
management
of
system.
that? Are you doing any of that now with any kind of softwares that are out there?
Thousands of patients every day are going back and forth with utilizing our interoperability tools between clinical systems. We're also a third-party administrator. We also manage claims for large national payers that we have that experience in managing claim data. And so that's part of our secret sauce, as you might call it,
Exciting.
that we can actually extract all that data, and it's clinical and financial. That's what
And does that also play into health population, the whole area of chronic disease management and so forth?
Extremely. Obviously, clinical integration and being able to do clinical outcomes within practices. Physicians are going to have to prove themselves out there in the industry whether their care models are working
And is that
and
connected-
successful.
Is that connected to their revenue?
Absolutely. That's how the payment system is actually going to be migrating, and how it's going to evolve in the future is physicians will be paid based on outcomes. How are you treating diabetes? How are you treating congestive heart failure and COPD? These disease states that cost insurance companies a great deal of money, and the federal government, Medicare. Physicians will have to, and hospitals will have to prove themselves as that their methodology and their practices show positive outcomes, at least meeting industry standards.
Exciting.
Yeah.
Well, there you have it. We are excited about what we're going to be bringing you soon. Healthcare technology made easy, and looking forward to our next show.